we have large parts of Africa where there hasn't been a lot of good data being generated about the true prevalence of COVID-19 and its impact.
And so with the onset of COVID-19 in June, we sort of recognized the opportunity to leverage a lot of those resources that were already existing on the ground and to pivot to focusing on COVID-19. And so what we had done was to repurpose the Z-Prime study capacity and to focus on enrolling all deaths across all ages and testing for COVID-19.
So the testing really is the difference. We have not been testing as much as we should have tested. So we cannot really determine the extent of this epidemic here without testing. And that is the gist of everything here. What I was talking about is we have not tested people.
What we did was we sampled about 10% of all the bodies that were coming into the morgue, all the deaths that are coming into the morgue for COVID-19. It wasn't surprising that the rate was higher in the elderly, but we also found high rates amongst younger people. So it had a different pattern than what we found in the West.
And then we have a lot of data coming out of South Africa, which is, a very different context from the rest of the continent. South Africa being a relatively wealthy country. And so in the place where we see the best data from sub-Saharan Africa, we also see the best, the highest impact.
Towards the end of the study, the government ramped up the testing, and we saw that the numbers were actually reducing of the people that were infected. But I think with people following what's happening around the world and knowing that the second wave is coming, I think these data are coming at the right moment, really, to tell people that we cannot relax, and the second wave will certainly come, and we have to be prepared for that.